it?
Hi there, and welcome back to another COVID-19 update with Dr. Manfred Green, Director of University of Haifa's International Master's Program in Public Health and Global Health Leadership, hosted, of course, by the American Society of the University of Haifa. Dr. Green, we're delighted to once again have you with us. How are you keeping?
Very well, thank you, James. As I mentioned to you, I'm in quarantine because I've just returned from Denmark. And so I have to be in quarantine for 2 weeks. I'm not sure who's protecting who against who, because I come from a country where there's very little disease, basically.
Got you. But you're halfway through that quarantine, I understand.
Right, halfway through.
Good. So listen, I'm going to start today with the latest news coming out of Israel, where the number of virus cases are actually down, yet the percentage of positive results are up. Now, this obviously implies that less testing is being done. Can you explain why this is the case and what it means?
Right, I think I need to start with something that may be obvious, but that we're going to see random variation anyway. So we'll have days that it goes up and days that it goes down. And remember that the people who are testing positive today actually acquired the infection maybe a week ago. So what we're seeing is not basically infections today, but infections that occurred some time ago. So I don't think it's related to anything that's changed at the moment substantially. But you're right that there may be some change, or at least a reduction in the testing. I know that on Saturdays there is a drop in the testing. So that could be part of it. But I'm not altogether convinced that this isn't somehow still a kind of a random event, that it's still, you need to really follow these things for at least a good few days, if not more.
Right. So, I mean, obviously countries like Israel, which were initially praised for their exemplary response to the virus, are now being portrayed as I guess, providing a cautionary tale on premature or miscalculated reopenings. Is this a fair critique?
In order to keep the cases down, that probably makes sense, because if you want to keep the cases down, you have to introduce restrictions and you have to maintain them at a pretty high level to get the cases from a high level down. And then you have to open up very slowly. I'm going to actually maybe open another line of discussion that we can talk about, and that is, what do we mean by safety, and what do we mean about risk and so on, because it's spoken about very freely, but in fact it's not quite clear whether people know what it means, or at least not so much that they don't understand it, but that the communication is often problematic. So for example, if you say, well, we can, slow the lockdown or slow it down, that doesn't mean that we're not going to have cases coming because we've slowed it down. It means that we're going to accept a certain level of risk. The question is whether we can quantify that level, or whether, at least, or whether that's meaningful for us to actually have some kind of quantity.
Right, so next I actually want to go on to behavior of people around the virus too. And I know this is actually something you've discussed with us at some length in the past. Do you have a sense that people around the world, or specifically in countries like the US and Israel, are approaching social distancing slightly differently to what they did in March, despite the resurgence of the virus? If so, is it because people are simply fatigued with social restrictions?
Right. This is also something that's not entirely unexpected. First of all, you have to maintain a fairly high level of anxiety for people to maintain these restrictions, because if they're not concerned about being infected or infecting others, then there's much less motivation basically to maintain these restrictions. And I think that in a sense, there's a level of anxiety that changes as the pandemic goes, or the crisis continues. There's a certain amount of adjustment In other words, you kind of, or an adaptation, where you actually get used to some kind of risk and you actually then become more of a risk taker. And this is even more problematic when you actually have to convey to people that they are endangering others. It's, I guess, easier to explain to someone why they're endangering themselves. But when you have to get the message across that they're endangering others, that's a problem. So wearing a mask, for example, is very important to protect other people. So that, people who would say, okay, but I don't really, I'm not worried because I don't think I'm going to get the disease. And even if I get it, I'm not concerned about it. But that's not the issue. The issue is you're going to infect somebody else who may be a high-risk person and then suffer major consequences.
Right, absolutely. So I guess another element that has been under the focus is education and back to school. Is a safe return to an in-person school environment possible in September, and if so, how?
Okay, so I'm gonna almost reverse the roles and ask you questions, but we'll see how you do. We often told never to do that. When you're being interviewed, never ask the interviewer questions. But maybe we'll engage a little bit in that discussion. Let's go back again to what I said about the so-called risk-taking and so on, because we're speaking about safety now. What do we mean about safety? And that's commonly spoken about. Can we safely reopen schools? Well, does safe mean no cases? Or does safe mean very few cases? And if so, how few? So it's a very both subjective and vague subject, which is to some extent avoided because it's difficult to quantify. I'll give you one quick example, just although it's not exactly in education, but I'll come back to that immediately. There's a paper now that just released where they try to estimate the risk of being infected if you were on an aircraft and you were either sitting in the middle seat or in the aisle seat. And there are difference, 1 in so many thousand in the middle seat, and so a little bit more or less in the aisle seat. And then, of course, it depends where you're flying from and so on and so on. So you can actually, they've tried to actually give a number. So whether we could actually say opening the schools would increase the risks of cases by 1% or whatever, or it would endanger some people by X%. In other words, either family members or teachers or whatever. So the concept of safely opening schools is really a very problematic terminology. It's problematic terminology because I'm not sure whether safe for you is the same as safe for me or somebody else. I mean, I know I got friends who ride motorbikes and they tell me it's perfectly safe, and it doesn't look safe at all to me. So again, maybe you're doing that, or the coconut or whatever. So it's really, in the end of the day, it's the kind of risk that we would be wanting to take against the benefits that we think we'll get for it. And that's essentially what we're looking at. So we're saying we want the kids to go back to school because it's good for the kids and it's good for the economy. Although I'm not sure why people keep telling us that it's good for kids to be at school. They keep I don't know whether do we need to be reminded of that? I guess we're all convinced that it's good for kids to go to school. So we don't have to be reminded of that. All we need to talk about is whether we can do it and not increase the risk of substantially increasing the number of cases and substantially endangering people who are at high risk. And this is extremely difficult in this situation, because I noticed also in the papers that are written, they often talk about the number of deaths. Well, when you talk about the number of deaths, it's also difficult for people to conceive. Obviously, for young people, it's a remote possibility, and for older people more. And also, it's a measure that's not entirely the only measure, because the disease can be a very unpleasant disease without people dying. So I think my answer to you again would be, if we can get the rates down to the level, let's say, that you see in Denmark, which is very low. I mean, they have maybe, although it's gone up a little bit, let's say they have 30 or 40 cases a day in the whole of Denmark. I'm not sure of the exact number. But and then you'd say, okay, we can open schools, and then the chances of infection will be very low. And very low is, again, you can challenge me and say, what is very low? But let's assume we accept very low. and therefore it won't be transmitted easily. But then we really have to talk also about the teachers, who are, so a lot of them are older, so they are also going to be exposed. So, these are the things that we need to look at. And at the end of the day, though, we are going to have to say we are prepared to accept X level of risk because of the Y benefit that we'll get from it.
Right. Look, it's such an interesting topic as well, because, being us both situated in Israel, we saw how the reopening of schools, it really went from a period where we were under lockdown to all of a sudden schools being open. And, we saw in Israel the devastating effects of new cases and the resurgence of cases being accredited by a lot of people to that back to school situation we had over there.
No, you're quite right. And again, it's going to be a discussion that's a difficult discussion, because, as you said, the actual increase in cases seem to be very problematic, and the increase in hospitalization, some may argue that that's a price that's worth paying. You may not like that kind of argument, but that's what we do. In fact, I could argue, and I don't think the comparison is problematic because this is not influenza, but that's what we do with influenza. We don't close schools generally during influenza epidemics. Occasionally we do, but we don't usually. And yet we know that people are getting infected and there are deaths. So do we get it to that level? In other words, do we say, okay, let's try and keep it at the influenza-like level? Remembering that this disease, though, spreads much more easily, and it causes, in elderly people, in older and high-risk people, it causes much more mortality. So it's a balancing act. But I think I'd go back and say to you, we need to look very carefully at the risks and at the benefits and make a decision. And that's really what we don't have a choice. We must decide. And we need to have the best data. I'm just wondering, and I'd even ask you, would you like to have numbers associated with these risks? I mean, if I said to you, this is a 1 in 1,000 or 1 in 10,000, or, would that be more helpful to you to make a decision or not?
It's a very interesting way of looking at it, yeah.
This is what I ask, by the way, in the committees that I'm on for the Ministry of Health. I say to them, maybe we should try and more quantify, even though the quantifying is very inaccurate. It's very crude because we don't have very good data. But it does give us some kind of measure that you can use to say, okay, it's more risky than this, or it's less risky than that, and not necessarily have an exact number. But this is what we'll need. So if you say to me on the end of the day, should we let primary schools open? I'll say, because the benefit seems so large and the risk doesn't seem too high, that's probably a good deal. Yeah. And if you went to secondary school, then you would start saying, well, maybe now the risks are higher and the benefits maybe are not as high because they could study online or some other way, capsule, things like that. So that's what we're going to have to do. But the concept of saying, can we safely open schools is a problematic question. I know people are asking it all the time.
No, I think you're right. I think the only way to decide, without the assumption that things are going to go back to normal is by quantifying it. I think that's a very valid point. Okay, so taking a more macro view, I suppose, at the future lies ahead. There are conflicting reports about who leads the race to a COVID-19 vaccine, the US, Russia, or China. Does it matter for the world and for America which country gets there first?
I don't think it matters in the sense that if a good vaccine is produced for any disease, then it's great. So we have a good vaccine. And the assumption is that at some stage it'll be marketed and it'll be an open market, and whoever needs it will get it, or at least that's not always the case. The rich countries usually get it when they want it. The poorer countries have to wait in line. But the situation now is a little bit more complicated. So I'll complicate it slightly for you and tell you why. there are two possibilities. One is that the countries are now very much aware, acutely aware of the fact that they want to be independent of the market. In other words, they don't want to be standing in line. So this is one of the reasons why each country wants to try and develop their own vaccine or sign agreements or whatever, so that they, are going to be first in line. But let me put you into a situation, just to give you an example of how complicated it would be. Let's say a good vaccine is produced in the UK, and a couple of countries buy it, and they're very pleased because they were near the front of the line. They managed to get this done, and it then turns out that the one made in Russia is actually a much better vaccine. But they've already bought the one that was made in England and maybe even started to vaccinate with it. Do they then try and buy the other one? And what do? Do you go back to the same people you vaccinated saying, you know what, we gave you a vaccine that's not so great, we're now going to give you another one? I think that we're going to meet these kind of decisions, and it's not going to be easy. So the answer to your question is probably we would like to control it as much as possible. At least each country wants to control it as much as possible. But at the end of the day, I don't think that, I think that we're going to have to collaborate with each other. Otherwise, it's just going to be chaotic.
Right.
I know that I think the Russians or the Chinese, the Chinese, I think, have started to vaccinate already their military with a vaccine they have. So we can wait and see. But if they don't have much disease in the country right now, we won't know if it's effective unless they stop the lockdown. And then, will they take the chance of stopping the lockdown to see if the vaccine works? That'll be an interesting challenge.
I would indeed. And I guess following on from exactly what you're talking there, is a vaccine the comprehensive solution that many people would think it is? Or should we be prepared for the current environment to persist for some time, despite the possible future existence of a vaccine?
The vaccines are really the only tools that we've had up to now to really contain dramatically infectious diseases. If you think about it, if we do this, what was done for smallpox, you would trace the cases, and then you would vaccinate around the cases. In other words, prevent it from spreading. What we're doing now is we're tracing the cases, and then we're trying to identify the contacts and limit their movement. So it's a very much more difficult situation because we don't know who they are, all of them, and also, assuming even if we do, to control their movement is very difficult. So the vaccine gives us that opportunity. You isolate a case and you vaccinate around that case, or whatever. There could be different ways of doing it, or you vaccinate on a wide scale. The vaccine doesn't have to be 100% effective. It could be maybe even 70% effective, and that would already be much more useful in doing this kind of containment, particularly when we get so you could do a combination, get the numbers down very low, and then start vaccinating with a vaccine that's not outstanding, but is enough to bring the numbers down dramatically. So I think that this is probably what we're thinking about. I can't believe we're going to have a vaccine that's 100% effective. I think that we're all going to be very happy if it's 70%. We're very happy with the flu vaccine, which is maybe about sometimes 50 or 60% effective, and sometimes even less. So what we would say is, okay, let's at least get to that stage. And I think that that's probably what's going to happen.
Right, interesting.
So it's going to be a kind of a mediocre vaccine, but good in the meantime. The companies will not say that, of course. They'll tell you it's going to be a fantastic vaccine. Right.
So I guess looking ahead to the winter, do you have a sense of whether or not the worst of the pandemic is still ahead of us?
I would love to be optimistic, and I know that people want to hear good news and so on, but you really have to look at two factors. One, it's a respiratory virus, and the typical of these respiratory viruses and the corona families, one of them is that they thrive much more in the winter or in colder weather. They spread more easily. People are close to each other. They're in room. So that's the theoretical side. People are saying, well, why is it spreading in summer? And that's typical of pandemics, when in the beginning, most people are not immune. It's very easy for the virus to spread. Once you get a certain amount of immunity, and I'm not even talking about herd immunity, but just an increased level of immunity, it's more difficult for the virus to spread. So when we go to the winter, we go into another situation. So basically, I want you to look at a couple of effects. Look at South Africa, which was, I think I've mentioned it before. It was predicted and South Africa is now number 4 or 5 in the world with the number of cases, and it's spreading very rapidly, and they haven't been able to, and that's with lockdown, by the way. They tried, I'm not saying how successful it was, but by law, they've had a very strict lockdown. The other is Argentina. Somebody said to me, well, it's not happening in Argentina. I would say to you, watch Argentina. Argentina is rapidly going up. In fact, in the next few days, I would say in another week, there'll be about 300,000 cases. They'll be amongst certainly the top 10 and maybe getting it to the top 5. So these are countries, and look at Australia as well. Australia now, who they said is also having problems now, even though they had this strict control. You can see in Victoria, it's much more difficult to control, and that's in a country where they had this island lockdown. I mean, they had all the kind of benefits. So winter is certainly going to be much more challenging, and that's why I think that we need to prepare for that. And I think you've heard me say this before, and people are probably tired of it. I would say that kids should not be in school in the main winter months. I say January and February, I think is going to be a problematic. Try and get teaching done in the warmer months. I would say the same about universities and so on. And, just recognize that in those months, they have to restrict these large gatherings because it's just going to be much more difficult to control. That's it.
Right. Well, it looks like that's all we have time for today. Dr. Green,
Great.
I want to thank you as always for giving us your time and knowledge. If you do have any questions for Dr. Green, please leave them in the comments section of this video or email them to info@asuh.org.
James, sorry, can I interrupt you? I'm sorry.
Please do.
I just wanted a last message because people say just a last more optimistic message. Using the masks and social distancing and so on are very effective. People should feel at least that is an effective way to do it. And we can, in fact, keep the number of cases down much lower than they are now. So it really depends on collaboration amongst people and cooperation of the public. And we can probably open up workplaces and so on more so. But we do have tools that have now been demonstrated to be pretty effective. So we should use them. That's right. Sorry about interrupting.
No, thank you for jumping in. I think it's an important message for all our listeners. Again, if anyone does have any questions, do leave them in the comment section of this video or email to them to again, it's info@asuh.org. As always, for more information about the university's work around the pandemic and support the university during this time, please find a link included in this post. Thank you for tuning in, and of course, please stay safe and informed. Thank you.
Thanks very much, Jen.